Hello, I'm Dr. Rhonda Johnson. Today's Saturday, November 16th, 2024. So let's talk about the U.S. Department of Health and Human Services, or HHS, and why the recent buzz about its secretary nominee matters. First of all, what is HHS, Health and Human Services? Well, it oversees programs that impact Americans from the cradle to the grave, and it has a budget of over $217 billion. It's the heart of our nation's health and social services programs. Now, there are so many agencies and offices within HHS, but here's just a few of them. The Administration for Children and Families, ACF. This manages programs like Head Start, refugee resettlement, and child care. Then there's the Administration for Community Living. This supports older adults and people with disabilities to live independently. Then there's the Centers for Disease Control and Prevention, the CDC, and that agency protects the public health through disease prevention and emergency preparedness. Then there's the Centers for Medicare and Medicaid Services, CMS. Woo, that's a big one. They administer Medicare, insurance, Medicaid, CHIP, and the health insurance marketplace, otherwise known as Obamacare. Then there's the Indian Health Services. They provide essential healthcare services to American Indians and Alaskan Natives. Then there's the National Institutes of Health, a global leader in medical and biomedical research. Don't forget about the Food and Drug Administration, the FDA. That agency ensures the safety of drugs, pharmaceuticals, medical devices, food, and more. And there's the Substance Abuse and Mental Health Services Administration, SAMHSA. This one has programs that address substance abuse and addiction challenges. Now, these are just a handful of the many agencies making HHS a cornerstone of public health and safety in the United States. And I didn't even talk about all the offices. So why does the secretary role matter? Well, the HHS secretary isn't just a cabinet member. They're responsible for leading and overseeing a massive domestic agency with critical programs that have a far-reaching impact. Now, past secretaries have been experienced leaders like governors, attorney generals, and healthcare executives. In my opinion, the ideal candidate must have expertise in managing population health, have interagency collaboration, and experience managing enormous budgets. The Health and Human Services Department impacts every community in this country, every community. So I think it's an important position. And I want to ask you, which of these agencies do you think has made a difference in your life or community? And do you think this is an important topic? Please share your thoughts. That's my message today, folks. Take care and be well.